So I just wanted to go over a couple of main points regarding some advice and recent guidelines that have come out if you are pregnant or looking to get pregnant. I've been talking a lot about this on This Morning and ITV News, and I'm getting lots and lots of questions come in about this particular topic. The government is suggesting that all pregnant women should spend a period of time, we think around 12 weeks for the time being isolated essentially, so minimizing any social contact outside of their home. And this is essentially being done because the government is recognizing pregnant women as a higher risk group that essentially is more at risk of coronavirus because of the fact that they are more immunosuppressed as a result of being pregnant. So if you find yourself being pregnant at this time, the advice about when to stay at home still applies in terms of having a low-grade fever or persistent cough or feeling generally unwell or mild symptoms of what could be coronavirus or an infective episode. The advice is still to remain at home and to avoid coming into hospital. However, if you do feel really unwell, or if your temperature soars, or if you're worried about anything to do with your baby, then you must contact your local unit. If you are severely unwell, contact 111, but otherwise call your local triage unit, maternity unit, who do need to be notified if you're going to come in, because they need to be able to institute appropriate measures in order to look after you and safeguard all of the other women who are there, as well as the newborns, plus protect their staff. So it's really, really vital that you communicate with them about this prior to coming into hospital. Also, if you are going to come into hospital, you must make sure that you minimize the number of people who come with you. Ideally, it should only be one person and no more, because again, it's really, really important that we limit the number of people who are potentially exposed to the virus. So the other new advice that's come out is that if anyone in your household has any symptoms suggestive of being infected or having coronavirus, then it's really important that all of you self-isolate for 14 days. And actually, if anyone in your household is potentially affected or is unwell, it's really important that if you are pregnant, you also take measures to protect yourself from them and vice versa. So it's vital that you attempt to isolate at home and have a room that's dedicated to you, that's well ventilated, that you eat at different times of the day, that you use different equipment, different utensils, different toiletries, different towels and things like that, to just minimize any contact for those 14 days of essentially being able to transmit the virus, especially to yourself if you are pregnant. So that's really, really vital. I know it's difficult, but it is important. Now, the reason the government is recommending all these extra measures is because we simply don't know enough yet about the effect of this virus on pregnancy. Now, most of the evidence at the moment is really, really reassuring. And actually, the majority of women, even if they are affected, should be fine, as should their babies. However, in a small number of cases that we've seen with coronavirus around the world, it appears that potentially there could be an increased risk of preterm labour or delivery, and possibly some effect on the baby's growth. Now, we don't know this for sure, but as a result, if you are found to have coronavirus, then you will be followed up with a scan 14 days later to check on the growth of your baby. Again, this doesn't mean to say that this will happen or that you will have any complications from having coronavirus, but it's necessary for us to be cautious at this time. The other reassuring thing is that the majority of babies born to mothers who have so far tested positive for coronavirus are absolutely fine. At the moment, there isn't any evidence to suggest that vertical transmission, so from mother to baby, is actually possible. We don't think that that's the likeliest scenario, but we can't rule it out 100%. Out of all the testing that's been done, none of them have shown that coronavirus is carried in breast milk, which again is really, really reassuring. And it does mean that those mothers who want to breastfeed should be allowed to do so. And in fact, it's really important that a mother is allowed to do this, because actually breast milk carries a lot of really important proteins like antibodies. The other thing to say is that if you are suspected of having coronavirus or have any symptoms, then it's important that you do deliver on labour ward, and this is because we need to make sure that help is on hand if you need it, and it's the safest place for you, which is where we can monitor you and any potential complications that this sort of infection might have on you and your baby. So in summary, so far from what the evidence that we do have from a small number of cases, it appears that coronavirus doesn't seem to be leading to any bad or drastic complications for the mother or baby, and that at the moment vaginal birth is still possible if that's what you want to do, and also breastfeeding is also possible and safe. We're all in this together. We all want the best for one another, and as medics, we are here to help you. We are here for you. And I don't want anyone to panic about any of this, which is why I felt it really important to just put some of this advice out there. But please just try and follow as much as you can. There are regular updates, advice is changing, sometimes even on a daily basis, and I'm going to try and keep you up to speed as much as I can. So, I may be doing another video very soon as well for you. But please do just bear with me on this, and let's get through all of this together as safely as we can. Sending you lots of love. Bye.